I'm a professor and a nurse scientist at the University of Washington. And my whole career has been dedicated to helping people with cancer communicate better with their doctors and nurses. The doctor usually explains a whole list of options from a menu and then says to the man, "What would you like to do?" And that's a really scary question because this man has just been told he has cancer. And perhaps in his life, he's heard about other people with cancer and he thinks that the best thing to do is just get rid of it. But that's not the case with prostate cancer. We know that there are more options than just removing the tumor. So I like to call the prostate cancer decision the archetype or the scariest decision of cancer that there is. Different men have different fears and concerns, and they're influenced at a different level by these. Being able to talk about what's important to them, to these men, is critical for making a decision that's going to match their personal preference. And the best doctors will solicit or ask for that information, but not all of them do. Some of them think their job is to lay out the options and then turn it over to the patient without getting that information from the patient. When the conversation comes together and the doctor and the patient make their decision together, that's what shared decision making is. We know from research around the world that the more shared the decision is, the higher the satisfaction with the decision is afterwards. That if men participate in making that decision, not only are they more satisfied, they have lower regret levels. But African American men have higher regret than white men, and they are diagnosed more often with prostate cancer than white men. So this is a really important focus that we need to have. I think gay men have very similar concerns when it comes to a prostate cancer decision as heterosexual men. There are, of course, specifics about what a gay man would be concerned about, but all gay men are probably concerned about intimacy and survival and incontinence as they are as heterosexual men would be. What is going on in this patient's head that's important to them, getting it out of their head and into the conversation with the doctor? Because the doctor is the expert in the medical facts and can easily review very accurately what's going on from the medical standpoint. But bringing that together is what's so important with those personal factors. And providing education to men about the different treatments. We've tried, I think, in every healthcare situation, and very much in prostate cancer, being able to tell the doctor what's important to you, what you're concerned about, what your personal values are. All of those things are critical for making a healthcare decision, not just prostate cancer. You are a whole person. There's more to you than that tiny slice of time that you spend in the doctor's office getting that consult. And all of that, what's about you as a man, needs to come forward when you're making a healthcare decision.